Hey everyone, how's everybody doing today? I hope life has been treating you well. Now, if you live around the Northeast, then definitely you kind of feel like winter's coming because a chilly breeze really hits you in the face. Now, I got here a view of Manhattan, obviously. Just going for a little walk. Now, if you see that little tall thing sticking out, that's the Central Park Tower, which is about 1,600 feet tall. It's the tallest residential building in the world, actually. And if you think about it, Empire State Building without the tower is only about 1,200 feet. But with the tower, it's about, it can reach up to 1,400, 50 feet. So just imagine, the overlooking platform or the viewing platform in the Empire State Building. Just imagine that being your bedroom window. If you do live in the Central Park West, or no, I'm sorry, the other tall building is called the Central Park West Tower, and then the taller building is the Central Park Tower. So yeah, so that could be your bedroom view if you do live in the Central Park Tower. Now, I will do a review, an NCLEX review later on, but in this video, I want to do a quick chit chat. I want to talk about burnout. I want to talk about exhaustion, right? We're not machines, we're humans. Now, when the body's out of its thermodynamic and homeostatic balance, we get sad, we get depressed, and we feel burnout. But understand, guys, that only when we are self-aware, right, of this imbalance, right, can we then interject and apply some of the coping mechanisms that I will talk to you about today. So, let's have a little chit-chat. So, yes, we go to work, we eat bad food while at work, we're having a bad day and a long day at work, everyone is getting on our nerves, and we are dehydrated and are eating McDonald's value meal with our third cup of coffee for the day, which means we're over caffeinated while severely dehydrated, and we come home in a messy house, clutter all over the floor, and dirty dishes all around. Sounds familiar? Raise your hand. Now, picture a stove in your kitchen, right? With about maybe 4 burners usually, right? Now imagine, usually it's a big one, there's a medium one, and then there's usually 2 small ones, right? Now imagine that each burner represents a major priority in your life. If you're a family man or a woman, I can assume that the bigger burner priority is your family. The medium one might be your career and finances, and the 2 small ones might be your health, and the other one might be for extended relationships, such as friends and having a social life, right? Now, I believe that having each 4 burners and prioritizing them accordingly leads to what I call a family, career, health, and social life balance, right? So when we feel burned out, we can assume that there is a big imbalance happening in our lives. Maybe our health, both mental and physical, and also our social life is being taken over by just work, and more work, right? To maybe compensate for the bills and the debt that we've had accumulated from having too many stuff and maybe the bad decisions that we've made in our lives. So let me ask you this. How are your priorities balanced? Remember, always try to dig deeper and ask questions. Learn from your mistakes and stay balanced, guys. That's all. Now let's go ahead and talk about our NCLEX review, and we will be going over penicillins. So let's go over penicillins. On our review, we're going to be doing a review with a view of New York City, right? So that's pretty cool, guys. So penicillin, the most common drugs that you will most likely encounter would be amoxicillin, ampicillin, penicillin G, right? Now understand that penicillin is bactericidal, right? It inhibits the synthesis of the cell wall, okay? Now, penicillin is also mostly effective against gram-positive organisms, okay? Also with moderate to severe infections, such as syphilis and Lyme's disease. Now, let's look at the side effects. We're looking at glossitis, which is an enlargement of the tongue, right? Now, it's basically usually an immune reaction to the medication that causes this. We're also going to be looking at stomatitis. Now, stomatitis is like mouth sores, right? There's going to be some inflammation in the mouth, in the gums, and it's very painful. So you do have to be mindful about this, guys. Another side effect would be diarrhea and super infections, which, as we all know, is a secondary infection that is imposed by the first infection that would cause the, the virus to be resistant to the treatment, to the first treatment. Okay, so that is a very, very important um, side effect that we do have to be mindful about. Now, what do we consider um, as a nurse with this patient? First, we're gonna make sure before the treatment that culture and sensitivity is done, right? Because sensitivity analysis is very important in order to determine any allergies and also to find the most effective treatment, really, right? For culture and sensitivity. We're also going to monitor the serum electrolytes on our patient, especially if given IV, because it can affect the cardiac status of the patient. So it's very, very important. We're going to monitor and rotate the injection sites, and we're going to look at for any discoloration, any inflammation on the sites. Now, back to stomatitis. Therefore, we do need to educate our patient to have good mouth care, right? And lastly, we're going to instruct the patient to take missed drugs as soon as possible, but they do not need to double dose, okay? That is very, very important when taking penicillins. Now, that's it, guys. I'm going to enjoy the nice view over here and have my work-life balance. And you guys, I hope you guys are having a great day. I wish you guys a blessed day, a safe and productive day. And I will talk to you guys again soon. Make sure to subscribe and hit the notification bell so I will check you out on the next video. Thank you, guys. Love you. Bye bye.